All right, well, it's great to see everyone here this morning. We're just a little bit before 9, but we have a packed agenda today. Well, when don't we have a packed agenda? And so I would like to get us starting off running. I'm trying to stall till we get to actually 9 o'clock on my computers. There we go. So Rosemary, would you like to kick us off this morning?
Thank you, Rob, and welcome everybody. Every Friday we come here, except on some holidays we don't, but every Friday we come here to this open table where we share what we do and connect with each other and learn how to be better at what we're doing. We acknowledge that we meet on the traditional lands of the Puyallup people who have lived here since the beginning of time and continue to steward the land today. We also acknowledge the effects of historical trauma, of conquest, genocide, and stolen lands, and our responsibility to listen to the voices of those who seek every day to build a strong and secure future for their people. Today, 47 of us at this moment have gathered here, and we'll hear updates and there will be requests for actions. And when we look at the agenda, we may not see a lot that actually gets us closer to ending homelessness, but the members of this group have put a lot of effort toward lessening its effects. We know we can do that. We believe we must do that. In fact, we learned about sharing when we were little kids at home or at school or at a faith community or a neighborhood or maybe all of these places. We may not have learned very much about systems as we grew up, and that's a real disadvantage when we're seeking long-term solutions to the persistent problems of economic inequality and racism and sexism that lead to homelessness or fuel it. If you're new to this space, you'll soon learn that we have differences in our approaches to systems change. We're a coalition of individuals who bring our experiences as advocates and organizers, as persons with lived experience of homelessness, as representatives of social service agencies and governments, as business owners and members of faith communities, as healthcare workers and problem solvers. We speak with one voice only after discussion and a vote taken during one of these Friday meetings. This doesn't happen often, but on our way to understanding systems, lobbying one another and elected bodies, and insisting mightily for change in these systems, we take our early learning about sharing and helping seriously and make the difference we can. This micro work, while never enough, and while it won't end homelessness, is always what we can do. There will be lots of conversations over this coming Thanksgiving week about all we have to be thankful for. And I'll probably join in some of that because I am thankful for so much, including all of you. But meanwhile, people living on the streets are cold, dispirited, and unsafe, and should have better options. We need the sharing micro work as well as the demand for a deeper societal commitment to sharing that will change the systems. To center us on our work today, I leave you with a short poem by Bernardo W. Overstreet called Stubborn Ounces. She directs this poem to, quote, the one who doubts the worth of doing anything if you can't do everything. She says, you say to that person, you say the little efforts that I make will do no good. They never will prevail to tip the hovering scale where justice hangs in balance. I don't think I ever thought they would, but I am prejudiced beyond debate in favor of my right to choose which side shall feel the stubborn ounces of my weight. So welcome to more stubborn ounces as we work together. So for those of you who are new or maybe returning from some time away, just a reminder about the way we operate here. We now have 67 folks here, so be aware of the fact that there are a lot of people who may have something to say. We ask that you keep your self on mute when you're not speaking, and that if you're doing something that might be distracting, to stop your video as well. Also, use the raised hand function when you're seeking to be recognized, so Rob can see what order people are in. And if that's not possible for you, do something else that wave about madly. We'll try to make sure that you have a chance to speak. We ask that you use the chat for information that you want to share with people. It's a good place to ask questions. Somebody will always respond, and it does go rather quickly. You can get a little lost in it, but just to remind you that we use this as a space for conversation, and the chat is saved. And if you aren't too familiar with our webpage, if you open it up on the right-hand side under presentations, you'll find the latest things that have been posted that have video of our session, a machine transcript of the session, and access to the chat is there as well. So we ask that you do that. And for our community norms, Rob has put those in the chat. I haven't looked yet, but that's kind of what he does. To remind you of how we ask that we all speak with respect for one another and think about the issues rather than the persons when we're making critiques. We also direct you to think about visiting our webpage to understand more about us and how to get involved. So with that, I'd like to welcome anyone who's new to introduce yourself very briefly. It's the time just for your name and if you're associated with a group or a project. And then you can put more information in the chat if you would like more contact. So anybody who's new or been away a while, raise your hand and we'll recognize you. Courtney.
Sorry, y'all. Name's actually not Courtney. I forgot to change my name. My name's Carmela.
We lost you a little bit there.
Sorry about that. My name's actually Carmela Saxey. I am on the board. Well, I am Courtney Love's intern through the LEC and the outreach with Maria, but I'm not her intern. I'm just a volunteer through helping out with their outreach. Hello?
It looks like Rosemary is frozen up. So thank you, Carmela. It's good to have you here.
Thank you.
And Rosemary, it looks like you're back. You were briefly frozen.
I was frozen.
Yeah.
You go ahead. That's fine.
Okay. Julie, you're next.
Hi, I'm Julie Redblood. I used to be on the homeless or the Coalition to End Homelessness years and years ago, but I'm now the program supervisor at RI International Evaluation and Treatment Center. We're an inpatient involuntary psychiatric ward.
Welcome back, Julie. And Ann.
Hey, good morning. I'm Ann Dorn. I am here kind of in my capacity as firm manager for Beverly Allen. She's a local attorney who is interested in legally challenging the camping ban. And we're just here to learn and kind of hear from folks who are in the field and stay kind of on top of conditions that, you know, some of which could possibly lead to a legal challenge. I'm also the co-chair of Tacoma DSA, Democratic Socialists of America. And so this is my first time here, just really happy to support this and learn about everyone who's doing this work.
Thank you for joining us, Ann. It's great to have you here. Next is Bianca.
Hello, my name is Bianca. I work at KWA, Korean Women's Association, as a housing specialist. And yeah, I'm just here kind of like Ann, you know, just to learn and see what everything's about. I heard about you guys from my coworker, and he had heard about you from the police, I believe, the police, because he goes to training and everything like that. So yeah, just to see more about what you guys do and everything, the resources.
Thanks for joining us. And Faith, you have your hand up as well.
Hello, I'm a little sick right now. Sorry about the voice. My name is Faith, and I am the Ignite National Fellow for Washington State. And I have resources that I want to channel into the community. And so I'm here to see how to best use my time and resources and organization to best serve this cause. So that's why I'm here. Thank you.
We're glad you're here, Faith. And anyone else who is joining us for the first time or rejoining after some absence. All right, I'm not seeing anyone else. Rosemary, did you have more you wanted to say?
No, that's fine. Go on ahead.
All right. Well, thank you very much again, Rosemary, for opening our meeting in such a thoughtful way. And let's shift right over to talk about everything that we're seeing happening on the streets this week. There's obviously been cold weather. We have the city of Tacoma's camping ban beginning. We have a sweep at 34th and Pacific, and we have the new site opening at 35th and Pacific. So there's a lot to talk about. If folks just want to use the raise hand function, or if you're on camera, just literally raise your hand. I'll call on you and we can work through this real quick. So let's start with Jeffrey.
Good morning, everyone. Well, yesterday was a bit of a busy day. There is a major problem I do need to bring up. I was at a Veterans Village yesterday, met with Tammy, and talked to several of the campers there. They have had a fire marshal and or inspector, don't know which, who have shut down their buddy heaters, even with the tanks outside the tent. So they have a very cold camp right now. I don't know what's going to happen at the new site at 35th and Pacific, because I understand that was the same plan that the city had there. So don't know enough yet to say one way or the other, but the last, before they got the buddy heaters at Veterans Village, they had 3 tents burned down because of candles. So the buddy heaters have been shown to be very effective, especially with the propane tanks outside the tents. But I think that I needed to bring this to the coalition because this is a serious thing, especially these next 2 nights that are very, very cold. So I'll leave it out to you. Also, the sweep at 34th and Pacific has been going pretty well. I've met up with several of the people I know there who are taking the new sites. They are going to the new mitigation site. They were pleased about it. They were happy about it. And they were excited about going there. They were concerned about the cold. And these tents are a little smaller than the ones at Veterans Village. But those are the 2 complaints that came to me. Thank you.
Okay. Thanks for raising that, Jeffrey. I saw Luis's hand shoot up. So Luis, you want to talk about the situation at the Forging Path site?
For referring to it as Forging Path, that's what we're gonna call it from, at least on my side. I'm not gonna call it mitigation, I'm gonna call it Forging Paths. We are actually providing each person with a Vornado heater. We actually look for the safest electric heaters. And actually each tent on this project have their own electric outlets. So today I'll be actually connecting those for them, and each tent will have an electric heater that is safe to have.
Thanks, Luis. And how many folks, just since you're on camera, how many folks have moved into the new site so far?
I haven't checked in with my outreach team, but I was there last night at about 8 p.m. And I know that we were already on the second row. So we are past the 15 people in it.
Great.
I will check specific numbers, but we are doing it methodically. Sometimes we assign the tent, but the people have to run back to the site on 34th, because if not, their property will be disposed of. So we're doing this slowly, methodically, with trauma-informed, not rushing, and not putting them at risk.
Thank you, Luis. And Monique, I see your hand up.
Hey, good morning. I'm sorry, I ran to the kitchen and then I heard something about buddy heaters.
Yeah.
What was said about them? Because we had buddy heaters in each tent, and we had the propane hooked up outside with the hose running in, but we had to remove them all yesterday. So what was said about them?
So that was just what Jeffrey shared with the
Ah.
group about the situation at the Veterans Village.
Ah,
And he raised the question about whether that impacts the forging. I don't have the name down yet. Forging Path site that's opening at 35th and Pacific. And they are using electric heaters in the tents.
That's awesome if you have electricity.
Yeah. Yeah. So Jeffrey was just raising the question and concern about the heaters and that there's a need there. So
Yes. Okay. Thank you. The city is trying to help us work on that, but I just thought I might have missed some idea on how
Got
to heat them. Okay. Thank you.
yeah, you're welcome. Teresa.
So I'm really happy to hear about the campsite opening, and I'm sorry, Monique, about what's going on. There's a low tech solution that I use when I'm carp camping, which is hot water bottles. I don't know if that would be useful for the short term, but at least people would have warm feet. Really, though, what I raised my hand about is that my street is like a ghost town. I don't know how many of you might have driven by G Street lately. The G Street mural campsite is completely gone. And today, kind of as we speak, they're bringing in big boulders to put on our street that has always been a welcoming place for people. So it's a little heartbreaking. I've thought about asking for people to come and paint Bible verses on the stones because it's St. Leo's who's putting it up. But no, that's not really what I'm suggesting. I'm just saying it's sad, and I keep trying to find where people have landed. So if you run across folks from the mural campsite, maybe let me know and I'll stop by. Thanks.
Thank you, Teresa, and sorry for that drastic change. I know we knew it was coming, but that doesn't make it any easier. And yes, downtown Tacoma is growing a bumper crop of rocks right now. So anyone else with updates on what they're seeing on the streets this week? Well, we do need to keep our agenda moving forward. And if you do have additional information to share, again, the chat is a major tool for us. So please do use the chat to share information that you want the group here. There's 95 of us in the room to know about. We're going to spend a couple of minutes now about the need and share section of the meeting. And I can't recall who was going to actually kick this part off. Was that you, Jay?
Possibly. I was going to cover the spreadsheet today, but we also were going to get feedback from Kenneth about the services. So I don't mind going first.
Okay.
Hello, everyone. Do I have a ability to share screen?
I can certainly give that to you. Just a second. You should be able to do it now.
All right. Can you see it?
Yep. Although what we see is a document where you took some notes from the chat.
Oh, sorry. Wrong window. Doing wonderful today, right? I'll do it this way. Thank you for your patience, everyone. So this is data sheets that Zoe started, and I've added some things and would like to continue with some things. It's built off of the hope that we can start inputting everything here and make a shared information space for all of our services and all of our outreach so that we can connect and know where each person is going. There's a user guide that Zoe put in here that has some minimal instruction. There's the suggested projects, there's camps, there's contacts, there's outreach, supply, share, and need, which is the most important for us today. If we can start utilizing this as what we absolutely like prioritize as necessity, it would be very helpful. And if we can all come and enter here and leave notation in here, that would be awesome. I'll be putting this in a chat in just a moment. Sorry about that. We also have the supplies. And this is the beginning. Some of this will be shifting over the weekend to show what we have so far requested and needed. This is just kind of in its rough stages. But people are encouraged to come through, and like this resource page is new. It would be really great if we had our individual providers come in and put their information for what they're offering and their times and dates, and then we can actually have an up-to-date, accurate information on who offers what. We have a beds, which I'm updating currently with the information from Lewis, and I'll be pulling other information, and other people are welcome to come in here and enter in how many beds they have available for that day. And so this would just be a great opportunity to make sure that we're all on the same page together in a continuous format that we're all inputting on, so that we all have that shared information every morning at our fingertips, and anybody can put it in what they need and what they don't need at a time.
Thank you, Jay. That's great. And if you want to, there you go, take the share screen off. I do know folks have been using this. Like I mentioned in the chat, I put the link to the Google Sheet in the chat, and then I also mentioned that folks have reached out to me for supplies. I don't know if that has happened with others who have put things on the need and share portion of the sheet. But during this cold weather that we're experiencing this week, it's been a useful resource. Speaking of cold weather, real quick, Kenneth, would you like to talk about the meetings that have been being held on mornings? I know that they're going to wrap up here with the cold weather supposed to end on Sunday morning, but this will be something that will resume when weather gets cold again.
Yes. Really quick before I do that though, Faith and Jay and Zoe were also working on a web portal so that the public would have access to also enter in their extra supplies and resources. Jay and Faith, are you all okay with talking about that really quick? Or Zoe, if she's here as well?
Yeah. Yeah. So I've been trying to make a form for each type of data that we want to save. So like supplies that will be donated, supplies needed, transportation teams that are available to pick up and drop off supplies to each site. And I've made it so you can designate which district you are working in the most, because usage recommends we do it by neighborhood or by district. So that creates a more sustainable process, I think. So yeah, so I just provide some forms there that kind of make it convenient to log that data. And you can also see that data that is logged under each form. And you can go to that spreadsheet and then see what is needed, what isn't. Yeah, okay. Yeah, that's it.
Thank you, Faith and Zoe.
Hi, everyone. I just want to thank Faith for doing that work and confirm that the list of camps will not be publicly available. I don't want people having access to that to go harass people unless they're part of the like it doesn't need to be heavy vetting, but not just any old person.
Thank you, Zoe. So Kenneth, any final words you want to add to close out this section of the meeting? Then we need to move on.
just a couple words?
Yeah.
There's
go
a
for it.
lot happened. Yeah, so, okay, so last week, we all found out that there were apparently outreach meetings taking place, but none of us were aware of them or even in them. This week, over from last week into this week, we worked tirelessly to actually get as many people into those meetings as we could, as well as share information. Clearly, I won't be able to give all of the information right here that we did get, but we got everybody that was there amazingly started working together. The community-based outreach programs were actually partnering with the organization teams, as well as like city efforts. The health department came through and donated, I don't remember the exact number, but it was like $5,000 worth of supplies, as well as backpacks. People started working on how to store stuff for each other. People started working on how to share the information together and make sure that that information was available for not just their teams, but for each of the other teams. It was quite a great weekend, or a great week. It was very tiring, but it was great. We were able to get the maps. Tacoma was not involved in those, and coincidentally though, Tacoma has started coming forward with a bunch of the information. They did release the actual detailed maps with street names, so that now we have those of the stability sites and the ban zones. We started talking about appropriate bed counts, not just bed counts where we talk about like all the beds that are available in the city, no matter what they're for, but how to refer people to different bed sites and how to get them into the places where it counts the best. So that way we're opening up the beds in like a cold weather shelter, but getting people over to crisis shelters instead. There's not much more. I mean, this work is going to continue. Hopefully everybody will still coordinate, but yeah. I know, I believe we're going to do more of this discussion on Monday at the safe sites. Is that true?
Yes.
I believe that's the case. Yes.
Safe Sites meeting Zoom at noon Monday, debrief and plan for the next go around.
And we did get the information that we were missing for those meetings as well, such as the hospital information and the injuries to cold weather. So we're doing fantastic. And I'm really proud of everybody that drove themselves into the ground, making sure that everything happened. We are keeping an eye on 34th because it is going to be the most direct evidence of how we're going to move forward, because they also released the schedule of sweeps too. So 34th is what we're watching right now, and that's where everybody's concentrating as we move forward. Thank you.
Thank you, Kenneth. And if there's additional information, links to anything, all that kind of stuff that needs to be shared, please do use the chat for that. So let's shift into our spotlight this week, and we've got quite a few folks here. This is gonna be a longer spotlight section than we usually do. But Thomas from Beacon Health Options, would you like to get this started?
Yes, I'm gonna go ahead and share my screen.
Yeah, let me give you that permission here. All right, you should be able to do that now.
Great. Can everyone see the slide?
Yeah.
Great, thank you. So hello, Homeless Coalition. My name is Tom Breitenbach. I'm the Housing Program Manager for Beacon Health Options. Beacon Health Options is the administrative service organization, ASO for Peers. Thank you for having me. It's been great to present about the HOST program. HOST stands for Homeless Outreach Stabilization and Transition. Is an outreach-based treatment program. So during the presentation, I'll do a quick overview and then I'll hand it over to Greater Lakes to provide more details. The program was initiated by the Blake Bill and is funded through the Washington State General Fund and administered through the Healthcare Authority to Beacon. It originated from DESC, the Downtown Emergency Services Center in Seattle in 1994, and is now being administered throughout the state in areas of high concentrations of unsheltered individuals. HOST goes out in the community and locates those with complex behavioral health needs, yet are least likely to engage in services. Eligible participants would have a substance use disorder or co-occurring disorder, experiencing homelessness have a symptom acuity level that creates barriers to accessing and receiving conventional behavioral health services. Host has the lowest barriers to accessing services with limited eligibility requirements, and we meet people where they're at. Host also provides stabilization services and intensive case management, and through the process helps address the client's immediate treatment needs and links them to resources with the goal of transitioning them to long-term services. The primary goal for the host program is to provide intensive case management and stabilization services with a range of treatment options, engage people experiencing homelessness and behavioral health challenges who are unable or unwilling to access traditional services, develop and maintain linkages to critical resources, including housing, psychiatric, and physical health care, financial support services, and other support services, transition, stabilize individuals to long-term behavioral health or other appropriate ongoing services. So that's kind of the general overview of the program, with a lot more details that Greater Lakes as a provider could be able to share with you. And so I've invited them here today, and I would like to hand it over. I did notice that Trisha and Glenn are here. I don't know if anyone else was able to come, but could you guys please share about the program, and I'll move forward with the next slide.
Hi, I'm Trisha. Yeah, Brandon is here as well. Brandon Rabisa, he's one of our intensive case managers. So I am one of the case managers. I'm also the certified peer on the team. And Glenn Kelly is our substance use disorder professional. And then we also have Elliot Bagwell, who is our nurse practitioner. And what we do, just like Tom said, is we go out into the community doing outreach. All of us are very familiar with outreach. We actually have worked together doing outreach just within different organizations for quite some time. And we find people who are struggling with a substance use disorder, can be self-diagnosed or professionally diagnosed, and who are limited on what services they are able to access on their own just due to those barriers. So that is the one of two requirements that we look hard and fast at, is that there has to be substance use, and they have to be living homeless or in imminent danger of homelessness. So we go out, we find people who are interested in services, and then we start from the ground up. And Glenn can do the substance use assessments in the encampments or in the field where we're at. And Elliot can help us address any medical needs. He's able to clean and dress wounds. He's able to write prescriptions. We are able to get people medically stable so that they can access inpatient substance use treatment. Brandon is very experienced with dealing with legal hurdles and helping people quash warrants. One example of that is we have a gal who's just really trying to get back on the right track, and we were able to go to court with her yesterday, and they are going to do a deferment of her charges because she's engaging in services. And for all of us that do this work, we know that sometimes the legal charges create a huge barrier for people. So the more that we can do to help advocate on that end, the better off we are. It also helps break down barriers for housing. Zoe, I see your question. The working definition of homeless is the same that HUD is. So they have to be living outside in a vehicle, in shelter, couch surfing, as long as it didn't mean 8 months of couch surfing and there was a night or two in shelter, we would definitely recognize that. So we would take it on a case-by-case basis. And I will turn it over to Brandon to talk a little bit more about things he does.
Good morning, Brandon Rabisa, case manager for the host team. Work alongside with Trisha and Glenn, as Trisha said. Basically, I come from the jail transition services part of things from before. So on this team, I've been kind of tasked with helping people navigate the legal system with warrants and getting jail access so we can go see clients that have been arrested and stuff and are in custody at the Pierce County Jail or SCORE or any of those. Honestly, it doesn't really matter. Other than that, I mean, I also help with the housing aspect of things too. I do have knowledge of that area as well, and just basic outreach things, handing out waters, food, stuff like that. And I will pass it over to Glenn.
It's on the bottom left.
And Glenn, it seems like you're still muted.
Glenn's having some technical difficulties right now, so he's working on it.
I can see that.
While Glenn works on that, I'll go ahead and move to the next slide. If there's some information here about, who's eligible and how do I refer someone to host? Does somebody want to speak about that, about the referral process?
All right, are we still on us or did you guys move on?
Oh, we're still on you, so you
Okay, I
found
just
it.
had to swap computers.
Ah.
So, all right, my name's Glenn Kelly. Some of you may know me. I've been in the field for a while now with multi-care behavioral health. I still do a lot of the same things that I was doing there for 10 years. I do assessments and placement into inpatient treatment or harm reduction models such as Suboxone treatment or methadone. We do we hand out some like Narcans and things like that whenever we have it, but it's very expensive and we're trying to get a cheaper source of that or maybe some more donations to be able to do that on a more regular basis. As far as our referrals go, one of the things that we need everybody to really understand is that this is one team that covers all of Pierce County. So let's say that you're a social worker in one of our hospitals in this county. If you refer every one of your clients to us, we get bogged down. So being selective and saying, okay, this client here is the one that I have the most of need on this day, and not just saddling us with 10 of your discharges. That's a really helpful thing to us because we're not just covering one person's hospital, we're covering an entire county. And we're supposed to be working with the hardest of the hard, and the most at risk. So that's just kind of what we're looking for out of referral basis, because we are talking to 95 people right now. And if everybody sent us 5 referrals tomorrow, you can imagine that that's not going to happen, right? And yeah, any questions?
Yeah, I'll respond to
Thanks, Glenn.
I think I would add to that, when we're thinking about this, we're thinking about those who are least likely to access services, but are in really high need. So, and I'm sure we all know some people, but it's some level, are they, ask yourself, are they able to engage? Are they engaging in some type of services since you're already working with them? And would they be a best fit for that? So, we so much appreciate the great work that Greater Lakes is doing so far. And they have had some incidents where they've had an influx of referrals before. So I appreciate you bringing that up.
I do see one hand up. Jan, did you have a question?
Yes, during inclement weather last year and the year before, we had to stand up shelters in strange places, churches, gyms, whatnot. And the shelter managers are perhaps familiar with the population, perhaps not. Would you be able to come to a shelter that's an emergency shelter that's only going to be temporary, but there's not necessarily a crisis going on, but there's a crisis brewing?
Yeah, it really, anybody can refer to us, Jan. So if a shelter called us, if we were able to be there, we would definitely come. Unfortunately, our hours are pretty close to bankers' hours because that's when homelessness is a problem, right? Is only during the day. But anyhow, so yeah, we definitely would respond if we had the capacity to do so. Just like we have in previous outreach. I also see, Jenny, you had a question about transportation. So if Elliot finds something that needs to be treated and he can't treat in the field, we will do whatever we need to make that happen. We've transported people ourselves. We can call some of our medical transport, such as AMR or TriMed. We also have good working relationships with most local fire and law enforcement jurisdictions. So we have been able to use them for transport. Worst case scenario, we'll order a cab, we'll order a Lyft, an Uber, we'll do whatever we need to do. So.
Great. And I see Teresa has her hand up.
First, hats off to Greater Lakes for gathering such a great group of people together. You all have reputations in the community, and we really appreciate the work you're doing.
Thank you.
Tricia, it's absolutely clear that you need at least twice as many people on your team as you have. And so my question is, other than funding, is there anything in the way of you doubling your size?
You know, we work from a contract with the Healthcare Authority in Beacon. So I think that's going to be a better question for Tom, if there's even an answer at this point. We did just launch in July, so I'm not sure that that's something that's even been tabled at this point. But Tom, do you have any?
So the current size is the negotiated number of staff according to the amount of funds that were provided. So if additional funds were provided by the Healthcare Authority, like there was an increase in the amount, then we could probably negotiate more staff at that point. I think they are considering the possibility of maybe adding a staff member with the current budget, but it's still in the air right now.
So if we as supporters of this work wanted to put pressure someplace to get more funding for you all, it would be the Health Authority?
If you believe that the host program would be a huge benefit to your community and they would need more of it, I would definitely always say that from letting your healthcare authority or your local
council members,
councils, know about that.
Hey, we have a couple here, so I just want to say we need more of this, especially we need it in evenings and weekends. Thanks.
Great. And so Thomas, is there more to the presentation, or should we take additional questions?
Additional questions. There is the last slide here that kind of describes a little bit about what happens after, what to expect after you provide a referral. So I just put it up there for.
Perfect. So anyone else with additional questions for the team? Patricia, I did see you had your hand up, but you put it back down. Did you have something you wanted to ask?
Well, there was a couple questions and the thing kind of got answered. I kind of wondered if it could be an ITA situation. Second, in regards to funding, HCA determines like where the funds could go kind of from Washington State, but there's other opportunities through healthcare for the homeless, HRSA funding from the federal government, so forth. There's other ways to get this funded with the initiatives for mental and behavioral health and substance abuse help. So just an idea. Thank you.
And then when you're thinking about this, is real similar to other existing programs, such as PAC teams. The difference, though, is that this is supposed to be even lower barrier for accessing services. Like the requirements for assessments are pretty minimal to be eligible for the program.
And I do see Jake had a question in the chat. What's the total amount of teams/staff DESC uses for their host teams? What would be the optimal number? Don't know if you'd have a question or an answer to that.
I would hand it over to Greater Lakes for that.
I don't know their exact number. They do have quite a few more staff than we do. I think one of the things that sets our team apart from probably all of the other host teams in our state is that we actually have an ARNP on staff. Most of host has RNs, or they outsource their medical to third parties. So many of you know Elliot. He was with the CMAR chat team for a long time prior to coming to us. And so he is out in the field doing outreach with us on a regular basis. So I don't know what the ideal numbers would be. I've done outreach in this county for over 5 years now, and I honestly couldn't tell you. One day I think I know the number, and the next day I'm definitely wrong. So
compared to other programs throughout the state, there's a huge variance in the makeup of staff and how many staff are in there. So and right now we're the state is launching the programs. They're really, really, really new statewide. And so, and the idea is to continue to grow it. And so they've started by focusing areas of high concentration of homelessness. And I imagine if there's a higher need, that hopefully they would consider adding more to the existing programs. So, but I would definitely advocate for that. I talk to the healthcare authority on a weekly basis, and I'll make sure I mention that to them.
So Thomas, I do see that there's a request for the slides. If you could share those in the chat potentially. Or if you just want to email them to me, I can make them available to folks as well.
Yes, I will email them too.
Okay, great. And I do see your hand up, Patricia, but I don't. We should actually move on to our next item in the agenda. So could you ask your question in the chat potentially?
It'll be very quick. I think as the coalition as a whole should advocate to HCA for mental and behavioral health. I think that's a really important because they've done a reshift and that would be really important to get services on the ground. Thank you. That's it.
All right. Thanks, Patricia. And thank you, Thomas, and all the great folks at Greater Lakes for joining us today. And if folks have additional questions, please do drop those into the chat. Thank you. All right, so let's move on to our next agenda item. And I do see that we are joined this morning by Pierce County Council member Janie Hitchen. Janie, you asked for a little bit of time on today's agenda to talk about the Pierce County Village and share, kind of address folks' questions related to that and other developments. So would now be a good time for that?
Yeah, I'm happy to jump in. Good morning. Sorry, I missed the first part of the meeting. For those of you that haven't met me, Janie Hitchen, Pierce County Council Chair of Human Services, and kind of sticking my head in lots of different places in Pierce County to get things going. I wanted to touch base about the village idea and just kind of let you know where we are. The holdup concerns and issues around it just really have to do with the land use for the site that had initially been chosen. And so we still really see this as a possible way of trying to facilitate supportive housing for our chronically homeless in our community. But there's just a lot of questions. So it is still alive. It is still moving forward as it can. But there's several very key things that have to happen to make it possible. And my colleagues that have been working on this really are very intentionally going through, because if it's going to work, it needs support. It needs support from the community, but it also needs financial support from a lot of different people. And it can't just come from philanthropy. And that's one of our biggest concerns. And then there's some land use concerns that are significant for the people that live in the community. The concern about putting septic systems for 200 to 300 people in an area that's been designated as a wetland. If anybody understands a little bit about septic, you could see some of the concerns that we're hearing. So there's some very specific questions. They've been well received. And we have staff from the executives team working on those and some of the partners that have been behind the scenes. So it is still live. It was not killed. And the council continues to really think that this could be a possible tool and a possible pathway to help some of our chronically homeless in our community. Still more work to be done. And the other thing that I want to just clearly say on here is my colleagues, Councilmember Mello's on this call, and I know that a couple others have been in and out recently. We will be doing a call to action. Many of you have been actively coming to council meetings and writing and asking for the 0.1% for housing and homelessness. And our plan right now is to pull that trigger and try and do it this year. And so when that happens, we need a coalition who's going to come and stand either on Zoom or in writing and getting out the actions. And so when you get emails from us or community partners asking to do things, and please do that. And it's a dual launch. It's looking at housing how do we build more affordable housing in this county, which we know is one of the crucial things to reduce the number of homeless, and how do we increase more shelter space? And we need funds that the county has to leverage both private and public dollars to make those things happen. And this is the tool that we have. So just be ready for that launch. My colleague and friend, Councilmember Mello, and his wonderful council assistant and the team that he's been working with, several who are on this call, have been actively working on kind of prepping this. But it is, as of right now, unless something has changed, the plan is to do that and try and run it this year. So we are super excited, but we know that we're going to need some help moving that forward. So happy to take questions about either. Like I said, Councilmember Mello is also on here, and yeah, so happy to answer questions if there's time.
Yeah, if folks want to raise their hands if they have questions regarding either the 1/10 of 1% for affordable housing or for the Pierce County Village project. Monique.
Good morning, everybody. So my question is regarding the Village project.
Yep.
So we are, people are getting funding to run this project, but donations have been down 7% this year. So all the other things that go with running these villages, it's very difficult for the nonprofit to be able to maintain. Are there thoughts of adding funding for the things that are recurring costs during the months?
So that's one of the things that we've really asked about, and one of our concerns early on before the land was even picked was, how are we going to pay for things? Because the way it is done in Texas, it just isn't doable in Pierce County. I don't even think it's doable in Washington State. We don't have that. We just don't have that we don't have oil barons dropping dollars, and our tech barons, and if you want to call them that, tend to drop dollars in King County. So I think that we have to, and again, that's one of the reasons. So the 1/10 is one of the things, because if we have county dollars that we can invest in those ongoing expenses, then we know it can be successful, because we will make sure that they don't drop below a certain level of service, that there will be food, that there will be, like, we need those things. And so that's one of those key features.
Thank you.
Yep.
Anyone else with a question that they'd like to ask on screen? All right, I'm not seeing any more right now, but if you have a moment to hang out, if folks want to drop a question in the chat, that would be fantastic. And I want to thank you for stopping by this morning. Oh yeah, there is a question from Richard. Are you saying that the 1/10 of 1% would go partially to the to the Village project?
So it is a funding source that could be used. We feel like it makes a lot of sense, because this is an endeavor, and we want it to be successful, especially in those first couple of years, because it's going to be hard to get it established. I think it's an opportunity. Right now, we don't have a funding source to support them with things like food and staff and such. So I think this is one pathway, Richard. And then Kenneth, I see your question, and I'm not familiar with the Bay Area Village. The one that we've been visiting is the Community First Village in Austin, Texas. But there could be another village. It's not like a secret.
All right, so thank you very much for coming and providing an update, and we will be active and make sure to share any information where we can be helpful in terms of the 1/10 of 1% when that comes through.
Okay, perfect. Thank you.
Thank you. So we did want to carve out some time for our breakout conversation this morning. And to get to that, we wanted to take a quick review of what we talked about last week. Timothy, do you have a moment to talk about that while I bring it up on screen?
Yeah, happy to do that. And I will drop this. There it goes. There we go. Just drop that in the chat. So if anybody wants to download a copy, it's right there and easy for you to do. Great to see the follow up on the previous chat about feedback to Dignity Village being taken up. That's really very encouraging to see that these roundtables are taken seriously and that people are actually working on the information that they provide. The last session was, the feedback from the last session is pretty brief. We didn't really have a lot of notes being dropped into the chat. So this is just a reminder that the quality of the roundup really depends on people taking notes during these sessions and dropping them into the chat so that they can be summarized. There was some very general feedback on what people are doing for outreach. I won't run through that, but you see that the 5 bullets up at the top, just some very general ongoing stuff that is being happening. And then there's a list of notable specific efforts. And some of this is some of this needs a little bit more information and context. So organizing soup vans on people's schedules, maybe people know what that's about. The 99 Stockings project, I'm pretty sure we've got some more information coming up later in this call about that. Some general feedback that we've been hearing over and over again about how these camps are being broken down into 1s and 2s and it getting harder to offer services to people who are out there. And Courtney talking about how she's created some figure 8 loops to try to get to those camps. Again, outreach getting more difficult. Concerns about foot care, that's ongoing, that never changes. St. Vincent de Paul's getting into some new stuff with inclement weather provisions. LASA, I'm not sure what that's an acronym for, has been doing some stuff here. FHN, I don't know what that's an acronym for either. Some winter items are being collected and given out. Some great work being done by the People's Assembly, some great work being done by the Mutual Aid Group. We've been hearing about that. A map app just created by Kim Ellefson. If someone knows more about that, maybe you can put it in the chat. And something about a permission form. So again, this is a reminder that when people are putting notes into the chat, to just try to give enough context that it's going to make sense to somebody else that is reading it. It'll increase the quality for everyone. And that's what we've got. Thank you.
Thank you, Timothy, and for taking a crack at that. Yeah, there were a lot of acronyms this time. So that's just a great reminder. It's very easy for us to use a lot of acronyms when we speak as well. We kind of live in that land, but it actually cuts down on the understanding and accessibility of information. So great reminder. So I have carved out about 10 minutes on our agenda today to talk, to kind of build on what the conversation was last week. We've recognized that as especially the city of Tacoma is pushing folks around the city related to sweeps and the camping ban, that people are splitting up into smaller groups of 1 or 2 folks. And so we thought it would be good to have a breakout conversation about how can we better serve small groups of people rather than going to the larger encampment sites that have been existing. And then on a related matter, what are some ideas for good small things that you as an individual can carry with you that you can hand out to folks throughout this winter as the weather grows colder. So I am going to set up breakout rooms with 5 or 6 folks in them, and we will spend the next 10 minutes. Again, if somebody could take notes in your breakout room from the conversation, try to make those notes as complete as possible, and then paste them back here in the chat when we return. That would be fantastic. We will come back here at 10:10. So away we go. Welcome back, everybody. I know that was a short amount of time, but we have a short amount of time left in our meeting this morning. So for folks who are note takers in the rooms, as a reminder, it doesn't really matter what your room number was. We just want to see your notes in the chat so that Timothy can work his magic around the information that you share. So hopefully that was a good conversation, even though I'm sure it was shorter than folks would have liked. We need to move along. So the next item on our agenda is an opportunity for any government updates. So I saw Caleb from the city of Tacoma is on the call. Caleb, do you have any updates from the city?
Good morning, everyone. I don't have any updates that you guys haven't already heard. Just as a reminder, the focus right now for the department has been working around the 34th Pacific encampment and transferring those folks over to the 35th and Pacific forging path and community site. So TRM, Tacoma Rescue Mission, has been focusing around the outreach part and the intake and transferring folks over. And then HEAL since Tuesday has been focusing around trash, debris, and abandoned vehicles at that site. So nobody is actually being removed right now until 35th and Pacific has hit capacity. And then if there's anybody left over, they will continue to be offered the other shelter options throughout the city, focusing on our other emergency and temporary shelter sites and permanent locations before asking people to move. As you can see on our website too, I'll post the link of the scheduled posting around removals of encampments throughout those areas of the 10-block radius around shelters is being scheduled. And so that one is being scheduled for 35th and Pacific starting this last week. So those are the biggest updates I have, and I will post the shelter weekly status reports and outcomes to the chat.
Let's see. Richard had a quick question for you, or potentially for Luis, if Luis is still here, about whether there's a way to bring supplies to the forging path site, and or if it's going to be locked up like the stability site is.
It's going to operate similar to the stability site, but we will let's wait until the site is actually full up and running with full capacity, and I can come to this forum and give better and updated information once we get everybody in.
Got it.
We can create that path, but I need to test how it's gonna work with everybody there, and then I can update the whole community.
Thank you, Luis. And there was a request if you could drop your email address into the chat, Caleb, and a couple other questions in the chat if you have an opportunity to scroll back. So let's shift over to get any updates from Pierce County Human Services. I saw Jeff was on the call earlier.
Yes, I don't have any updates for today. Sorry.
Okay. I also saw that Valerie was on the call. Valerie, anything you need to tell us about rental assistance or your work? And Valerie, I can see you're unmuted, but I can't hear you. Okay, so we'll move to someone else. Jenny, do you have any updates from the Tacoma Pierce County Health Department?
Hey, good morning, everybody. Happy to be back with you after last week. Flu is on the rise. That's the big news from here. We're seeing things tick up and get more exciting in the influenza world. So as I've talked about before, things are hitting earlier this year. I think Garrett got his flu shot. Everyone here, get their flu shot, please, please, please. We're actually seeing really great, I don't know how many folks know this, but the influenza vaccines are developed based on what happens in the Southern Hemisphere, because they get hit, before us. And so it's kind of a cool thing. But we are seeing information out of South America that this year's flu vaccine has actually been really effective. And so that is great news. Even if it doesn't keep you from getting the flu, it keeps you from potentially infecting others, and it keeps symptoms, it can lessen symptoms. So it's really, really important to do that, especially with other things going around and not knowing what COVID's going to look like in the next round or next strain of COVID. So please, please, please get vaccinated. I will share our flu page in the chat. You may have also heard that we have an Ebola situation in the US. It's nothing to be overly concerned about. Our state Department of Health is monitoring. There are about 100 travelers from Uganda where have been exposed to Ebola, and they're being monitored. Folks are being monitored really closely here. So I don't want folks to be overly concerned about that. I looked for some information from DOH on that, but they don't have the site up and running yet. So I'll share that when that's available. Our monkeypox situation is really steady. We haven't seen an increase in cases in several weeks. So the disease is continuing to wane, but we do have some events coming up in partnership with vaccination events and information events coming up with Tacoma Rescue, or excuse me, not Tacoma Rescue Mission. I was just looking at Luis with Tacoma Needle Exchange, and I will let you know when those dates are finalized so that you can let clients and others know if they are eligible for monkeypox vaccine. They could go and do that. And then finally, our congenital syphilis situation continues. Our STD team did some testing and surveillance at the 14th and 15th and G site before that site was removed. And we're able to get folks connected with treatment, but we're just continuing to sort of monitor that situation. Email that went out from me earlier this week included our STD team contacts, but if you didn't see that and you have questions about congenital syphilis or what you could be doing to help spread awareness or get folks connected, let me know and I will reshare that information. That's all I have.
Thank you, Jenny.
Thank you.
And I think there were
Some
a
questions.
couple of comments maybe in the chat, but not, I don't know if there were any specific questions for
Okay.
you.
I will check out the comments for sure.
Perfect.
Thanks.
And thank you as always for being here.
Thanks for having me.
All right. So Valerie, I understand your mic is working now.
I fixed it. Can you hear me?
We can.
Okay, this is just my voice. I am on almost 2 weeks of COVID now. And so this is as loud as it gets. My teenagers are loving it because I can't ask for anything except for text messages. So COVID is rough, folks. COVID is rough. So for rental assistance, the program, thank you, Jenny. I got my COVID vaccines too. I can't even imagine what it would have been like. It's been fun. So So rental assistance is still going strong. We're down to about 14 million. We have requested additional dollars, but we haven't heard back from Treasury if we're going to get those. So as soon as we know, we'll let the community know. If you have folks who are facing current eviction, as always, I encourage them to go to Tacoma Pro Bono and Northwest Justice, who have direct access to me. So if there's anything we can do on the side, we will see what we can do about processing them even outside the port. So folks email me directly and we'll get that processed through. The other update I have is the non-congregate shelter, which I am helping homeless and affordable housing out with, closes today. So they have until 4:30 to submit their applications. We have about $13 million for non-congregate shelter. So that closes today at 4:30.
Thank you, Valerie.
You're welcome.
Sorry to hear about the COVID, but hopefully it passes soon.
Thanks.
Yeah.
I was supposed to get my flu shot tomorrow, but I'm scared now. I might have to wait a little bit.
Yeah. Yeah. All right. So that wraps up our government updates for today. Let's see, real quick, I wanted to talk about advocacy. Some of you probably saw that I posted in the email list about a action with my day job with the Housing Alliance, where we're trying to urge the Washington State governor to include more money in his budget requests for housing and homelessness. I'll drop that into the chat here in a moment, but I wanted to make sure that folks in the meeting knew about it. We're trying to get at least 500 letters to the governor, or around 350. So more folks taking that action would be helpful. In terms of local activity, the city of Tacoma has its regular meeting on Tuesday night. They are voting on a number of items related to the budget. So if you would like to make final comment on their budget proposals, there's that opportunity to do so on Tuesday night at 5. And we, as always, will keep an eye on the Pierce County Council agenda. If there's anything that that needs our support or input, we will use the email list to get that out to folks. Let's shift over to Jan for a quick update for the Safe Sites for All group.
Thank you, sir. We are responding to the weather at this point because the weather is not safe for those who are living unsheltered. So Monday, we're going to have a debrief of this past, well, it's not even past, it's going to be a nightmare tonight and tomorrow night. We are grateful for the County Human Services to allow us to use the platform to connect to as many folks as possible. We would like to see more government involvement. So Caleb, please know that you and anybody from the city of Tacoma is welcome to come to any of our meetings, but specifically, we'd like to see the city represented this Monday noon at Zoom. Go to the website to register to come. Because what we talk about is who needs what and who is seeing what and who can deliver what. So please come, and hopefully we are going to be better prepared for the next one. As I've said before every event we've had. Thank you.
Thank you, Jan, for what you're doing. And to everybody else who's been pitching in to try to help people on the streets through this current cold spell. I think that's a great perspective, that there's an opportunity to make sure we have a better system set up for when more dangerous cold weather arrives, which it undoubtedly will later this winter. So I wanted to carve out a good chunk of time here during this last hour of the meeting to for us to have a kind of group conversation, as well as to drop things into the chat about Thanksgiving holiday related resources for folks who are homeless that that we want to get out to the community at large. This is our last meeting, obviously, before the Thanksgiving holiday. Because of the Thanksgiving holiday, we are not planning to hold a regular meeting next Friday. So because of that, we'd like to make sure that we've compiled a worthwhile list of resources that can be compiled, posted with a link on our website, and send out to the mailing list here between now and Thanksgiving itself. So let's see. I'm trying to think of the best way to do this. Do folks want to just kind of raise their hands and let us know about resources that you're aware of verbally? And then also, if you have the opportunity to drop it into the chat, it's going to be much easier to compile the resources in the chat. So I'll just kind of open the floor to folks. If you want to raise your hand and you know of a space where people can get a meal, where people can get clothing during the long holiday weekend. We know that that's going to be a challenge. All the kinds of supports that we know households need, whether they're out on the streets or otherwise, we'd like to compile the list. So let's get started with Jay.
Just a reminder, coming forth on like Christmas, we might want to do this at the beginning of the month or at least like the middle of now. And for Thanksgiving, we should be doing this a couple of weeks ago. A lot of programs will already be closed down or stopped by now if it's like a turkey delivery or anything like that, because they have to have the time to process the requests, the times and the dates of how many people are doing that. So there'll be a sheet for this also for like Christmas and next year. So as soon as we hear about it, we can add it to it. But anything that is available now would be great.
Thanks for that, Jay. So others with ideas, I know the call went out on the mailing list as well earlier this week. So that's why we wanted to make sure we spent a few minutes this morning. And I do see some folks dropping things in the chat.
Not to put the Salvation Army on the spot, but I know you're here and I know that you do something at Thanksgiving, right?
Well, that's happening right now. And in fact, I shouldn't even be here because we are yesterday and today we're giving away our Thanksgiving meals. And so there's, 1,000 people lined up outside the office, maybe not 1,000, but we're doing a lot. And if we have, and on Monday and Tuesday, we'll still be handing out food. I don't know if we have turkeys left. We had a limited number. Apparently, I mean, I'm not a big turkey fan, but apparently turkeys are really, really hard to find this year. We had to order way in advance, and then they couldn't guarantee it until 2 days ago. So that's happening right now until 1 p.m. today at our food pantry.
Thank you, Dr. Jarvie. Yeah, and as Jay and I both mentioned, there was a bird flu issue that caused an issue for farms across the country and led to some scarcity for turkeys this year. Others with any resources that they're aware of that we should share? All right, so please do continue to use the chat to share things that you're aware of in the community. And again, we'll compile what folks have dropped in the chat and get it out to everyone. But I also carved out some time. Yeah, Jay, go ahead.
Sorry, one other thing. The Gig Harbor Basket Brigade is still open until the 23rd for requests to nominate families for turkeys.
Thank you, Jay. Patricia?
I just want to say this starts a time of year where a lot of people that are homeless things come up in their head. So just a conversation, because they're not around family, they're not around whatever, their coping skills get more. I just wanted to leave that nugget of gratitude, because obviously a lot of them don't have families to go home to based on whatever reasons and so forth. So thank you for letting me share.
Yeah, thank you for that, Patricia. So we do have some time. I know Teresa wanted to talk about the 99 Stockings project. Would you like to do that now?
Jay, is your hand up from before or is it a new thing?
From before, I'm sorry.
That's fine. So first, I know that a lot of you have been involved in the 99 Stocking Project before. I put on the flyer that I made, I put, this is a collaborative effort. Even though New Connections has always been trying to organize it, a lot of you have helped to organize it and we couldn't do it without you. So I've got you on there, and also despite the NIMBY boulders, St. Leo's, there are parishioners at St. Leo's who have been deeply involved as well. So want to keep that rolling. It is, for those of you who don't know about it, it's a very simple project that is just, the intent is to provide a holiday bag for as many people as we can, particularly people who are unsheltered, but also some of the shelters we provide bags for. The ones that go out to people who are living on the street have more stuff in them. So not all the bags are the same. And one of the most favored objects that we put in there, and we've done pretty well so far. I don't know how we'll do this year, but I keep thinking we're not going to come up with enough, and then we do, is a $10 gift card that goes to the folks, so that typically they're corporations, I know, but they're also ubiquitous. So we have McDonald's and we have Starbucks cards that people donate to us, and we give one of those out to each person. So it's sort of a big effort, and the way we have done it in the first year we did it at the Salvation Army, which was a lovely space that we spread out and we put all kinds of stuff together. Then COVID hit, so we've done it differently. And now what I'm trying to find are people who are willing to work in teams. We have all of the socks we need for this project right now, but there are lots of other things we don't have enough of. And you've seen my request for the Altoid box. This is what it's for, is the 99 Stocking Project. There'd be some little medical supplies put in here. It's easy, fairly waterproof, and can stick in a pocket. So if anybody uses such things, they don't have to be Altoids. I'm not brand loyal, but something that's that size of 10, please save them. And you can drop them off on my porch anytime. I'm going to show you this list so you get a sense of the kinds of things we're looking for. And then I will take questions, and at the end, I'll put a link to this list, and also a flyer, which I have to do some work on our website to make it great before I send this out to everyone else, but I'm going to give it to you as my editors for this. So can I share a screen, Rob?
I just turned that on for you, yeah.
Thank you very much. So this is what I'm going to put a link into the chat for. And so we got it down to sort of a science. We have two of the big things that, in addition to the gift cards that sometimes are hard to come up with, are the stocking hats and gloves. We have people who knit some stocking hats that have been lovely, and I'm sure they'll do it this year, but I don't think they're going to be able to do all of them. And we have people who cut these fleece scarves. So scarves haven't been a problem, but gloves are a real issue, as are stocking hats. And then I'm going to scroll down this so you see some of the other stuff. There's some toiletry things, and then I'm scrolling down a little quickly. I don't expect you to read it all, but we put some holiday treats in there, and so everybody gets a candy cane and chocolate, and we work with the Beacon Center, and so the younger folks get chocolate Santas and so forth. The idea is, if anyone on this call knows of a community group, this is a great way to engage folks who might not be game for going out to the street, but they might be game for trying to gather some things. For those of you who are already doing outreach, please be in touch. If you let me know how many bags you could distribute and where you would distribute them, so that I don't do an overlap where somebody gets 5 bags and somebody else doesn't get any. I don't know exactly how to do that, if we had a by name list that was actually usable, or if we hadn't just swept everyone to the winds, it would be a lot easier to pull this off, but we will do the best we can to add a little bit of cheer to lives of people who are, as I think it was Jay who said, not a lot of cheer out there right now in the cold. So any help you can give would be welcome. I'll put the information in the chat, but if you have any question right now, go ahead. You're also brilliant. You don't have any questions. I love it. So I'll put the stuff in the chat and we can move along.
I wouldn't underestimate the brilliance of this group. Jay, go ahead.
I'm sorry. Do you mind if I put the link to your worksheet in the other sheet so that they can just access your worksheet and see what you need and don't need?
That is perfect. I appreciate it.
Great. Any other questions for Teresa? All right. So let's see. Next on our agenda is an opportunity for good trouble announcements. Anybody have any announcements for the 63 folks in the room here that would be useful to share? Yeah, Ryan.
So I had 2 clients come through my project, and both of them have different stories, but one of them got back on his feet and was able to move back, reconciled and move back in with his wife. The other one, who'd just kind of been hanging in limbo, trying to get into transitional housing for his set of circumstances, stayed here for a couple weeks and got out of the mission and was able to stay indoors all day. And a spot opened up for him, and he's moved out to Ording now. So 2 for 2.
Nice. Congratulations. Does that mean you have a bunch of space for folks in?
Yes, I'm empty again, so I got 12 beds. If anybody's curious, please contact me. I want referrals from anywhere and everywhere to build a community here. So I'd appreciate your help.
Thanks, Ryan. And if you want to drop your contact info in the chat, that'd be helpful for folks. And Patricia.
I don't know. This is not the best story, but a long-term chronic homeless man got into housing. He's only been there 2 months, but he had a heart attack and was not going to make it. But it's to also kind of consider when people do get into housing after long-term chronic homelessness that they need to be supported when they go in there. He had other bills for the housing that he wasn't able to maintain his phone to call for help, just the cost wise. So I just sort of wanted to put that out when we do get people into housing, that some of the issues that they were on the ground that they couldn't cope with move to that. So just consideration. Thank you.
Yeah, thank you for sharing that, Patricia. It's a tough story and a good reminder that the support networks need to continue to be there once folks are able to move into housing. Jeffrey.
As I was wandering around the 34th and Pacific camp yesterday, I ran into a woman I'd known probably 4 years. And so I looked at her and I said, hey, are you going to be moving into the new site at 35th and Pacific? And she says, nope. A month ago, I got housing. And I said, oh, you're kidding. She says, nope, I've got my apartment now and I am good to go. That's the best news I've had all day yesterday.
Yeah, that's fantastic. We need more of those stories. And actually, that's a great reminder that we do carve out time at the end of every meeting for folks to be able to share those kinds of success stories. So that's what fuels our work going forward. So anyone else with any items to share for the good of the order? Let's see, Zoe, and then I'm not sure, Jan, if you wanted to share something too next. So start with Zoe.
I put this in the chat, but everything was kind of rapid fire and I'm sure it got missed. Valley Liquidation, which is on the Tacoma Parkland border, has winter gloves, like the real good ones, in stock for $5 a pair, as well as sleeping bags for like $12, I think. I would have gone and cleared them out already, but I am homesick. If anybody would like to do that but doesn't have funding, especially the folks doing volunteer work, TMAC can probably help pay for quite a bit of that. Just reach out to me. I'll put TMAC's email in the chat again.
Perfect. Jan, did you have something you wanted to share, or were you just
Yeah.
clapping? Go ahead.
I pushed the wrong button. So
No problem.
I'm Jan from LASA. LASA stands for LASA. That's our legal name. And two things. Springbrook Connections is doing turkey dinners the night before. I don't have any information on it, so I'm going to put I don't have the contact. I'm going to put my email in the chat, and then I will put you together with the right person. Also, we're excited that several of you reached out for some of the mini fridges and coffee makers, and we have more. So I'm going to put my contact once again and just reach out to me. We'll be happy to supply you with some. Thanks.
Thanks, Jan. Andrea.
I just wanted to piggyback on what Zoe was speaking to at Valley Liquidation. That's like close to my end of town. And I deal with them frequently. And if there is anybody going in making a large purchase, ask for a discount. I just purchased bulk socks for them and they ended up being 37 cents a pair. And so they have great deals anyway, but they're also really awesome about giving back to the community. And even if it's helpful, just tell them that Andy, just say, if you talk to Kelly, tell him that Andy sent you in. And I don't know if that'll be helpful or not, but I've gotten food for schools and all kinds of stuff. So don't be shy about asking. They're happy to help.
Thank you, Andrea. And anyone else with items for the good of the order? So I did just drop in the chat the presentation regarding the host program that was given by Thomas and the folks from Greater Lakes Mental Health earlier today. So there's that for those who were attending and wanted to get that. Let's see. Oh, and it looks like others have visited the liquidators as well. So it's a great tip there. So let's see. The last thing on our agenda is just an opportunity if any other success stories wanted to be shared today. Anyone else was with a success story? All right. So before we close out today, I did want to remind folks we are not planning to meet next Friday. So I hope you enjoy your extra time and a long weekend with family, if that's what you do for the holiday. I see Courtney has a hand up.
Yeah, it took me too long to get back to the appropriate screen, but I have a success story.
Perfect.
A young man, freshly 25, so not eligible for youth services anymore, had been bouncing around and has his own vehicle now and is working with tablets that have gotten easier. You need less documentation to get tablets now, or Chromebooks, whatever it is. And so he's working, he's got a car. I directed him to safe parking sites. He's got his chin up and his outlook good.
Perfect. That's awesome. Thank you for sharing that. And Joe, I see your hand up.
Yeah, just so every Tuesday at 2:30 at Aspen Court, if anybody's trying to get a phone, we have Cricket comes in 2:30 and they can come in and sign up for that at Aspen Court. So they're scheduled to do that every 2:30 every Tuesday now. So I think that's super important, especially for individuals trying to get into shelters or waiting for calls and they don't have a device. So that's a big one. I know that because of the heron, we will December 1st, we will have a lot of beds opening up between our Tim's Forest site and Aspen Court, because we have about, hopefully it should be all 16 rooms should be emptying because they'll be moving into the heron. So we have 16, so hopefully that stays, but for sure there's 12 for sure. There's nothing could possibly go wrong for them. So by the 1st, hopefully we should have 16 rooms open as well, for December. So I think that's really great news as well. We transition into permanent housing. So, that's exciting.
That is exciting. Thank you for that. And just so folks have it, do you want to drop the address for Aspen Court into the chat so that folks can know where to send folks at 2:30 on Tuesdays for phones? That'd be great. And yeah, go ahead.
Here, this is Joseph. He is our new operations manager for our new Tequila site, Riverton, that's opening up in Tequila. So, I just want to introduce Joseph here, super amazing.
Love to see you over here.
Nice to meet you.
Would I be able to give just an update to that?
Sure.
This is Anita from Aspen Court, operations manager, and the Cricket individual is here every other Tuesday.
Oh, okay.
He will be here on the 22nd. So this next Tuesday, he'll be here from 2:30 to 6.
Perfect. And thank you for that clarification. And Teresa, I see you have your hand up.
So good news about the openings, Joe. And just, I have a question about the Cricket thing. Do people actually get phones that day?
Yes.
That's
Yes,
amazing. That's the way it used to operate and I've missed it. So I will drive our new resident out there and I should just go to the front desk and.
Yep.
And then I will put my information in here again. I know some of you already have it. I'll put my information in again in case there's any questions about like availability and stuff. I know Cricket is pretty easy one to get and it doesn't require, a lot of information, but we can get, 100% clarity if there's any, stipulations. But I think it's pretty straightforward about just having like an EBT or something like that. It's a pretty simple one.
That's correct.
Thanks.
Perfect. So, yeah, Dr. Jarvie.
Oh, I wanted to follow up on Joe. We had guests from a different SafeLink Wireless that also do the free government phones, and we had they came in and they gave a little introduction to some of our people, and they actually signed people up right then and there, and they had boxes with the phones and they left with a phone, and that's such a valuable resource for shelter residents and homeless people. So we've asked them to come back regularly. And so they're going to be at the Salvation Army Shield Center probably 2 or 3 times a month for people to come in and pick up a phone. And we'll have flyers with what they need to bring in, because you have to bring in certain things, but you can walk away with a phone, and it's such a wonderful resource. So I appreciate that. And so it's good that you guys are doing that also. Thanks, Joe.
Thank you for sharing that. And any other final items for the good of the order before we close out today's meeting? Well, I appreciate everybody being here and hanging in for a long meeting. There's a request, Dr. Jarvie, if you could put some of the information that you just shared into the chat, it would be helpful to put on our data sheets that we've been.
Jan is waving wildly.
Don't we have a social Thursday coming up? Because we're not meeting next week. And don't we have the first Thursday of the month social?
Well, we do have a first Thursday coming up. I was planning on announcing doing a reminder through email, but yeah, we'll definitely make sure that folks are aware of that ahead of the Thursday. I'm not sure if we're just back at 7 Cs this time or what our plan is, but And Jan, I see you have your hand up again.
Yes, I just wanted to say that with good news, with the small mini groups, somebody in the group was able to help me with the problem that we've had as an organization for over a year. And it's like,
Oh, wow.
hey, that's not helping somebody on the street, but it's kind of nice to help each other too.
Awesome. I'm glad to hear it. And Richard.
Please take a look at the email that's off to the listserv from Dana Peregrine with respect to Marlene's Deli. There's a woman in need there that Francesca has been in touch with today. If any of y'all that are professional outreach people are able to check in on this person, that would be appreciated and welcome. Francesca is the manager at the store at 38th and whatever street that is, and put out a call trying to get some help for this woman in a car. And information is in the email that you have received.
All right. Thank you, Richard. And with that, let's close out today's meeting. A great reminder that we may not be meeting next week, but we still have the email list that folks can use. People know how to get a hold of me for sure, Garrett for sure. So it doesn't mean just because we're not meeting next Friday doesn't mean the work is not going to be continuing. And so I wish everybody a safe holiday weekend coming up and a good weekend this weekend. And we'll see you in a couple of weeks.